Good afternoon, everyone. I hope you are all safe out there. With everything that has been going on lately, people have been looking for ways to cope with their problems in healthier and in more effective ways. This is most especially true in the case of parents who want their child to be healthy both physically and mentally. Today's webinar will help parents observe the signs and symptoms of their child, which will give them a basis on when they need to seek professional help. But before we introduce the speaker for today's webinar, I would like to call on Dr. Rowena Reyes, the Dean of the Institute of Arts and Sciences, for the opening remarks.
Good afternoon, everyone. Can you hear me?
Yes, we can hear you, Doc.
Welcome to the second installment of the Psychology webinar series, where all topics are dedicated to adolescent parenting. We would have wanted to invite all of you inside the Far Eastern University campus and the office of the Institute of Arts and Sciences, but maybe next time when we're allowed. Kamusta po kayong lahat? The Psychology webinar series intends to address the alarming increase in the reported difficulty of our adolescents in dealing with the incessant threats of the pandemic. In FEU, we feel very strongly that the university must approach mental health as a community. This means, apart from the efficient service offered by our FEU Guidance and Counseling Office, we have involved our administrators, faculty members, program heads, and of course, our dear parents in taking an active role in providing the needed support of each student. COVID-19 and the impact of learning technologies that are not only changing the formal education landscape, they're also changing how we navigate our connection with learning and socialization, affecting how we think, interact, and engage with everyone in our circles. With the pandemic, we are forced to thrive in an environment that does not offer any guidance on how to steer the complications it has generated. We have seen too many of our children glued to their gadgets, binge watch Netflix, missing out on the warm presence of family, friends, and classmates. Our panorama for learning and socialization, how and where these two occur, and what personal developmental looks like have changed and will continue to evolve in the future. And so we ask, how will our children, including us, survive? When we conceptualized this series, both my institutional and authentic ego was involved because, like you, dear parents, I have a Generation Z child, and we had several of our dear students in mind. With this, I acknowledge the hard work of Dr. Anel Humamil, who's also a parent. We'd like to extend our gratitude to Dr. Zairah Castelo-Corpus, our child and adolescent psychiatrist, for giving us time. I know you're very busy, ma'am. Salamat. Our parent reactors, Dr. Clarissa de la Riarte of FEU Department of Psychology, the very busy Professor Karen Panella, who's here also as a parent. Ms. Gab Rodriguez, our moderator and psychology clinic coordinator. Ms. Eda Lu Ochanco, FEU's Christian Evasco for the technical support. Please allow me to thank everyone who made today happen. I, as program heads, faculty, and students. I invite you all to join us in our future webinars. Once again, thank you very much.
Thank you, Doc. Thank you, Dean Wen. Now, to introduce our speaker, let us call on the program head of the Department of Psychology, Dr. Anel Humamil.
Good afternoon, everyone. Can you hear me?
Yes, we can hear you, Doc.
Thank you. A graduate of Doctor of Medicine at the University of Santo Tomas, Faculty of Medicine and Surgery in April 2009, a BS Psychology graduate of Ateneo de Manila University in 2005, our guest speaker had her postgraduate training for her residency in general adult psychiatry and fellowship in child and adolescent psychiatry at the Medical City in 2013 and 2016, respectively. To further her expertise in the field of psychiatry, she had her child psychiatry observership in November 2016 at Einstein Medical Center, USA. Currently, she is a fellow of Philippine Psychiatric Association, Philippine Society for Child and Adolescent Psychiatry, a diplomate of the Specialty Board of the Philippine Psychiatry, At present, she is the second-year level coordinator, Residence Training Committee at Medical City, in-house psychiatry consultant at Miriam College, guest faculty at Ateneo de Manila School of Medicine and Public Health, and the section head of Section of Psychiatry, Department of Neuroscience, East Avenue Medical Center. Our dear participants, let us all welcome Dr. Maria Zairah Castelo-Corpus.
Thank you for the kind introduction, Doctor. Can you hear me clearly? Yeah.
Yes, we can hear you, Doc.
Okay. Well, let me just hold on. Let me just share screen. Hold on. Why is it not sharing screen? Hello. Okay. Gab, can you see my screen? Just checking.
I will share the screen in a bit, Doc.
Okay.
Okay, I can see the screen, Doc.
All right. Okay. Can you hear me clearly, Gab? So
Yes, we
I
can hear you, Doc.
Okay. Good afternoon, everyone. So thank you for inviting me in this webinar, and I hope that this afternoon will be a fruitful um, time for us to learn about how we can help our children and our students as well, right? So the series is called Seeking a Professional Help, Determining Signs and Symptoms of Adolescents. No? So basically what we want to talk about is let's talk about mental health, right? And we know right now we have a mental health crisis wherein there's a lot of people, famous people, who are suffering from depression and anxiety, and some of them actually have taken their own lives. You know? So, and when we talk about mental health in the Philippines, they found out that depression is the most common mental health problem worldwide, with some 300 million people suffering from it, right? In fact, there is around 788,000 suicide deaths globally in 2015. You know, among Filipinos, we found out that 3.3 million Filipinos, or 3.3% of the total population, suffer from depressive disorders, right? While 3.1 million Filipinos suffer from anxiety disorders. Among students, they found out that 17% of high school students from 13 to 15 years old said they attempted suicide at least once. 12% said they seriously considered attempting suicide. And 11% have made plans on how they would commit suicide. And some of them has what you call social media envy, wherein there's a moderate, significant predictor of symptoms of depression. So we can see that it is prevalent in our country. So I want to discuss first what is mental health, right? So before we are able to understand the disorders or what are the things that we need to take note of, what is normal and what is abnormal, I want to give like a definition of what mental health really is. No? So when we talk about mental health, it's a state of well-being in which the individual realizes his or her own abilities, can cope with normal stresses of life, can work productively and fruitfully, and is able to make contribution to his or her community, right? So why do we need to talk about mental health problems in the youth, right? Well, we found out that young people have a high rate of self-harm, right? And suicide is a leading cause of death in young people, right? And because I'm a child and adolescent psychiatrist, but I'm also a general adult psychiatrist, right? And most people who are adults that come to me, and when I look at their histories, most of their problems started out early, when they were younger, right? There's also a strong correlation between poor mental health and many other health and development concerns for young people, notably with educational achievements, substance use and abuse, reproductive and sexual health. There is a mind-body connection So it is important for that.
Excuse me, Doc. Sorry.
Yes.
There is some technical difficulty, so can we hold it for a minute?
Sure.
Yeah. Doc, can you share your presentation again, please?
Okay, hold on. Let me share it. There. Is it there? Can you see it, Gab?
Yes, I can see it, Doc. Give me a moment. Okay, Doc, can you try to switch between to the previous slide so that we can check?
There. Can you see it?
Give us a moment, Doc. Oh, you haven't switched the slides yet, Doc?
I did. This one, I
I
did.
did. The why talk about mental health?
Yes.
Okay.
And then,
Okay. Okay. Excuse me to the audience while we are solving some technical difficulties. So thank you for your patience. Okay. Doc, can you switch again?
there. Can you see it?
Um, can you reshare your content po, Doc?
Reshare.
Yes. Oh, there. Now it's moving.
Mm. Can you see it?
Yes, we can.
If I play it like this, can you still see it?
I cannot see it moving, Doc.
There. Can you see it? Why talk about mental health?
Now it's moving, Doc. Okay, thank you so much, Doc, for your patience, and thank you to the audience as well.
Okay. Gab, is it okay now?
Yes, it is okay, Doc.
Okay. Sige. All right. Well, let me just continue from where I left off. No? So we talk about it on why mental health problems is important to discuss, no, in youth, right? So because there is a strong correlation. So it's not just about there is a mind-body connection. So it also affects the body, the physical health, you know. We know that 20%, according to WHO, of children and adolescents have mental disorders or problems. And mental and substance use disorders are the leading cause of disability worldwide. You know, so war and disasters have a large impact on mental health and psychosocial well-being. In fact, the pandemic is actually one of our risk factors, no, in terms of affecting our mental health during this time. But because there is still some stigma, it prevents people from seeking mental health care. So let me just kind of go to the Generation Z or iGen, which are kids who are born between 1995 to 2002. And these are your children who are currently in college at the moment, you know. Now, each generation, according to studies, have specific characteristics within them. You know? So let's kind of talk about them. So when we talk about the Gen Z generation or the iGen generation, this is what you call the iPhone generation because they never really grew up without the iPhone. You know? when they were born, it's always there. No, internet is a constant. No? They are said to have been influenced with individualism. They're very individualistic. No, and they also are more aware of income inequality concerns. No, and because of this, they are what they say more woke. No, as they say. No, parang they are more. They know more about what's going on. If you look at the diagram or the graph on the right side, the smartphone access, if you look at it, and this is back in 2018, I'm sure in 2020, it's more than that, no? And this is a US-based study, but they found out that 95% actually have an access of to a smartphone, no? Now, 45% of teens say they're online almost constantly, right? So almost constantly, they are either on their computer or the cell phone. No? So if you look at it in 2014 to 2015, and compare it to the 2018 data, there is an increase of people going online. So they say that Gen Z kids are more likely to grow up more slowly, right? They spend more time wanting to be teenagers, no? They are physically safe, but mentally vulnerable. No? So meaning they are aware that because they grew up in a time wherein there is more threats, no, physical threats, like where there are threats of war or nuclear disasters, they are more physically safe, but because they would most likely spend more time at home, they spend less time on homework, and they spend time on gadgets more. They spend more time at home, but less connected with family, because they would spend the majority of the time being online. They spend less time with friends offline. So the irony of this is that the internet makes us feel more connected, but what it does sometimes is that like when you're on the dinner table, we tend to be on their phones, instead of really connecting and having a conversation. So they say that there is a mental health crisis that is looming in the Gen Z population. They're actually more vulnerable than millennials. So the rate of depression and suicide is increasing since 2011. And research have shown that teens who spend more time on average on screen activities are more likely to be unhappy. Now, for example, 8th graders who spent more than 10 hours a week on social media are 56% more likely to be unhappy. And those who spend an above average amount of time with friends offline are 20% less likely to say they are unhappy. So in the Philippines, we have a study in 2013 wherein they evaluated college students, and they found out that the percentage of those who ever thought about committing suicide in the Philippines during that time is 8.7% of the people who studied. And among all respondents who tried to commit suicide, there's around 3.2%. So it's big. I'm sure the numbers now are higher. In a global school-based student health survey, which is a school-based survey in grades 7 to 9 in year 4, they basically measured alcohol use, dietary behaviors, drug use, hygiene and mental health, etc. And the overall response rate was 79%. The total of those participated was 8,761 students. And they found out that for the mental health part, that among the age, let's say 13 to 17 years, the percentage of students who seriously considered attempting suicide during this time was 9.2%. And percentage who did not have any close friends was 4.6%. Now, because we are in a pandemic right now, it's important to kind of talk about also how mental health pandemic is affecting our adolescents. No, one is that there is a disruption in the routine. No, so before we are currently shifting to a more online mode of learning, right? And before, if there's a routine, oh, they wake up at 8, they go to class, it finishes at this time, they go home, they do their homework. Now it's a little bit different, right? We are expecting that there will be more relapse in mental health issues because a lot of things right now is uncertain. So it's common to have responses wherein they feel more anxious, right? Depression and anxiety is common, because they aren't allowed to connect with friends. In fact, I've had some patients who really feel disconnected, because of being locked inside, right, the house. Because if before the way they cope with things is, for example, seeing their friends, they don't get to do that anymore, or like going out to the malls, they can't do that anymore. Children with special needs are also more affected during this time. What happens is that we all feel a certain overall feeling of loss, right? Because our routine was disrupted. Things are kind of up in the air. We don't know what's going to happen. Some students might have more traumatic experiences of loss during the pandemic. So, for example, they might have lost a family member during COVID-19. There's exacerbations of family issues. So since everyone is staying at home, if there are certain dynamics in the family that causes stress, it might be heightened. Feeling disconnected from friends. And of course, the financial issues that the pandemic brings about. A lot of people kind of lost their jobs or their businesses aren't doing so well. And so there is a consequent effect on the family and also on our children. In terms of online mode of learning, there is sometimes lack of motivation, right? Because I've had some kids that their feedback is that it's not quite the same as in-person learning. There's also lack of connection with peers and teachers. So before, if in between classes they can talk to their classmate, they can do that as much anymore. And sometimes there is a little bit of difficulty in understanding content. So the question, therefore, is how do we know if it is still a normal human experience? So let's go to what is an adolescent? What is a teenager, right? So there is a transition full of changes. There's physical changes, there's neurodevelopmental, there's psychological changes. And when we talk about adolescents, we say that this is a period of paradoxes, wherein they reach physical and sexual maturity before they are fully cognitively and emotionally mature. So it's like in between childhood and adulthood. And they are starting to kind of work towards a more integrated concept of self. So they're able to be able to build their own identities. Neurobiologically, right? The developments are taking place in regions of the brain. The prefrontal cortex, which is basically our executive functions, meaning it helps us to in decision making, so making things organized. The changes occurs later in adolescence than the limbic system changes, which is more for emotions. That's why most teens are more emotional, right, than more than practical, let's say, or no. So there's a disconnect between adolescents' physical capabilities because they are starting to mature physically, they're gaining their strength, and reward seeking and self-control, which underlies risk-taking behavior because their limbic system develops faster or earlier than their prefrontal cortex. For psychological changes, we know that they are in search of their identity, right? It's a major personality achievement for the adolescents. No? They start to define who they are, what they value, right? The directions they choose to pursue in life, right? And some of them experience what we call identity crisis, wherein there's a period of distress as they experiment with alternatives, before settling with values and goals. So going back to that question about normal human experience and what is a mental disorder, when it is normal to feel sad, nervous, sometimes angry, sometimes inattentive, but it becomes a mental health condition, such as depression, anxiety, or mania or ADHD, when there is an impairment in social and occupational functioning, meaning if these mood changes is persistent and it's starting to affect how they function, both socially and academically, right, in the family, then that might be a mental disorder. So if you look at the criteria for it, it's really a characterized by clinically significant disturbance in an individual's cognition, emotional regulation, or behavior, right? And that reflects in a dysfunction in the psychological, biological, or developmental process. So meaning the things that we talk about on how Gen Z generations are and how adolescents are, it is more than that. So meaning they are associated with significant distress or disability in their social, occupational, or other important activities. Okay. So when we talk about the model of health, we have different vulnerabilities. So there's a genetic vulnerability, like the physical health, disabilities, your temperament, IQ, drug effects, for example. The psychological, wherein there's the coping skills, their sense of self-esteem, social skills, and the social, which includes your relationships, and this all kind of encompasses a mental health, So when sometimes I've had parents who ask me, so Doctora, ano ba yung root cause? What is the root cause? There is no sometimes it's a combination of several causes or several factors. It's not just one thing, right? And for our youth now, stress is usually either coming from school, from family, from friends, from social media. There are several risk factors. For example, in the psychological, either personality traits, abuse can be one of them. Personalities. So in the family, if there is an inconsistent caregiving, family conflict within, or poor family discipline, sometimes death of a family member. For schools, can either be bullying or failure to meet academic standards. When you talk about signs and symptoms, it's really kind of broad. So I just want to kind of just focus on the common mental health issues that we find in young persons. Right? So one is depression and suicide. So these are when feelings of sadness or irritability persist and interfere with the young people's ability to function, right? So the symptoms would include helplessness, feelings of helplessness, weight changes, feelings of guilt, right? Sometimes I have had some teenagers who feel guilty for being depressed, abandoning hobbies or things that they like doing, they don't really like doing anymore. So for example, if they like playing computer games, it gives them happiness. It doesn't give them as much pleasure anymore. Sleep difficulties, so either they're having difficulty sleeping or they're sleeping too much, right? Appetite disturbances, either they are not eating, meaning they don't have any appetite, or they're eating too much, right? Sometimes for children and adolescents, there's more irritability, right? Isolation, wherein they really don't want to talk to their friends or their families, they just want to be alone all day. Loss of energy, feeling tired all the time, and thoughts of death. Now, there is what you call bipolar disorder, wherein it means that they have the symptoms of depression, but there is also on the opposite end, meaning they have mood swings, and the opposite of spectrum is that they feel like their mood is elevated or expansive or irritable, right? They have they would talk very fast, they have grandiose delusions, like they feel like they can do anything, right? They don't feel like they need sleep so much, they're very impulsive, so they would either buy things more, or they do things that they don't normally would do. Okay. This one I want to tackle a little bit because I think a lot of teenagers are starting to have these symptoms, wherein there's what you call non-suicidal self-injury, wherein there's a deliberate self-inflicted destruction of body tissue, right? So it's usually through cutting or scratching, so you can either see it during in your wrist, it meaning it's not deep enough, right? It's usually superficial cuts, but it's there, right? And the reasons why teenagers would engage in this is that one is because they want to manage painful feelings, Sometimes there's a lot of um, problems in terms of regulating their emotions. And the way that they feel that they can manage it is through hurting themselves. Sometimes punishing themselves, right? To communicate with others, or seeking a rush. In fact, some studies have shown that when they cut, it releases studies have shown that when they cut, it releases certain opioids which can make them feel a certain rush. No? It's kind of like a diagram. This is a diagram of what happens. No? For example, if a teen has a problem in regulating their emotions, no, or tolerating stress or distress, no, a trigger can cause an emotional response. No, usually either anxiety, anger, sadness, right? And the urge to avoid these emotional responses by self-injuring behavior or self-harm. No? Emotional responses by self-injuring behavior or self-harm. No? This can provide them temporary relief. Some studies have shown that when they cut, it releases certain opioids which can make them feel a certain rush. No? It's kind of like a diagram. This is a diagram of what happens. No? For example, if a teen has a problem in regulating their emotions, no, or tolerating stress or distress, no, a trigger can cause an emotional response. No, usually either anxiety, anger, sadness, right? And the urge to avoid these emotional responses by self-injuring behavior or self-harm. No? This can provide them temporary relief, but because they engaged in it, they feel bad about it, they feel guilty about it, which triggers them. So you see that there is a cycle that people go through. Okay. So what is our warning signs, no? If they are going through this? One is that there's an unexplained frequent injury, including cuts and burns, no? If you see students or your child wearing long pants and sleeves, even if it's super hot outside, then you might think, well, is there something that they're hiding? No, they're constantly wearing wristbands or large watch bands or large bracelets. No, they would have reluctance to dress up in swimming or PE classes, or they don't want to wear sleeveless. No, low self-esteem can be. No, difficulty handling feelings or emotions. No, they can't tolerate emotional pain. No, relationship problems, and poor functioning at school or home. When you engage in non-suicidal self-injury, it doesn't mean that they're automatically suicidal. Now, some of them actually would have uh, non-suicidal self-injuries, or they would cut, but they really don't want to die. But it doesn't mean that it will not reach us that at a certain point. No, some actually become suicidal. No, so when self-injury is no longer producing the desired outcome, and when they're feeling hopeless or feeling of pain being inescapable or loss of control, right? So this is kind of like a risk factors, no, that I want us to just kind of have an idea of on how it affects this behavior. No, so one is that, for example, risk factors would include bullying or abuse, right? Family stress, no. For example, substance use can also be other psychiatric illness, no. Breakups or loss or family conflict. Now, another kind of signs and symptoms that adolescents encounter would be your anxiety disorders, wherein they would feel like always kinakabahan, no? They're worriers, no? So there are different types of anxiety disorders. I will just kind of briefly go through them because there's a lot, no? But there's like what you call generalized anxiety, wherein it's a chronic excessive anxiety. So ito yung matitawag nating worry wart. They worry about so many things all at the same time, no? Sometimes to the point wherein they always worry that they try to avoid doing things. They feel always restless, or like they feel like they're on edge. They feel like they're so tense, no? Separation anxiety is wherein their fear of being separated anxiety disorders, wherein they would feel like always kinakabahan, no? They're worriers, no? So there are different types of anxiety disorders. I'll just kind of briefly go through them because there's a lot, no? But there's like what you call generalized anxiety, wherein it's a chronic excessive anxiety. So ito yung tinatawag nating worry wart. They worry about so many things all at the same time, no? Sometimes to the point wherein they always worry that they try to avoid doing things. They feel always restless, or like they feel like they're on edge. They feel like they're so tense, no? Separation anxiety is wherein their fear of being separated from their home or caregivers, meaning they don't want to, they're always checking up with their parents, or they don't want to be separated with them. This is usually more common in younger children, right? Phobia, I think it's kind of self-explanatory when there's a fear of a specific object, right? And social phobia, wherein the anxiety is really more connected to performance situations. No? There's also what you call panic disorder, wherein you get panic attacks. And when we talk about panic attacks, these are unexpected, brief episodes of intense anxiety without any apparent trigger. No? So what happens is that these are the people who feel like their heart's racing, they have difficulty breathing, their palms are sweaty. And usually it happens randomly. It doesn't have to be caused by something. Like you can be watching TV and then you get a panic attack. Obsessive compulsive disorder, wherein you have to do certain mental acts or behaviors to alleviate anxiety, right? And post-traumatic stress, which is what they were predicting that some people might feel after this pandemic, is when there is anxiety symptoms due to trauma. Then we have what you call ADHD, wherein there is a feeling of, or there's a symptoms of inattention and hyperactivity, right? So inattention would be failure to give close attentions or more careless mistakes, difficulty sustaining attention, losing things, difficulty organizing things, when you're talking to them, they don't seem to listen, Hyperactivity would be when they were younger, right? They would want to always stand up, walk around, always fidgeting, very impatient, would talk excessively, So this can also be one symptom. Okay. So after that kind of run through, what can we do, as family, right? Important is to notice the warning signs. So when your daughter or your son feels very sad or withdrawn for more than 2 weeks, you see that they're trying to harm themselves or making plans to do so. There's sudden overwhelming fear for no reason. They would start to have panic attacks, wherein they're so worried that they are unable to do daily activities, meaning they can't even go to school, right? They can't even turn on their laptops, If there's involvement in many fights or desire to badly hurt others, or there's out-control behavior, right? Important to also look for the red flags for suicide, So, for example, if they're actually talking about suicide, in statements like, I'm going to kill myself, I wish I were dead, or I shouldn't have been born. And sometimes you see this in social media, for example, in their tweets, in Instagram, If they give verbal hints with statements such as, I won't be a problem for you more longer, nothing matters, it's no use, and I won't see you again. And this is not common for them, then maybe that's a red flag, So online, we also have certain behaviors that we look at, Atypical behaviors would be, if they are starting to become more irritable or short-tempered, there's a deterioration in the quality of work, right? They become disrespectful in discussion posts, right? Or if, for example, they become like more manipulative, or their emails become threatening, for academic performance, you can see that wherein they suddenly have like late assignments, If before they were more diligent in turning on their assignments, they don't turn it on anymore, or they don't even want to go to class, So how do we approach them, right? First is that we really need to actively listen to them, right? So listening is really just kind of being able to Make sure that they know that you're there for them, to show empathy, to not be judgmental. No? So as much as we say, we don't want to use the term na, oh, maliit lang yung problema mo, bakit mo pinoproblema yan? No? Or, no, ako nga, nung bata ako, ganito ako eh, mas malaki pa yung problema ko. Yan. No? Because what happens is that when we do that, they feel invalidated for their feelings, and they might not be able to open up to you anymore. No? Show you care and give them time and attention. If you tell them, okay, I'm going to listen to you, then you are prepared, you should be prepared to listen to them, right? Not listen to them while texting or doing other work, try to, to show you care and give them time and attention, no? Now, we want to also be calm and accepting. So, for example, if they tell you that they're depressed, we don't want to panic, right? We just want to be calm, or oh, okay, you're feeling this way, no? And be aware of your own reactions. So even if you feel like naiinis ka, or parang you feel like you want to roll your eyes, try not to do that, no? So we want to try to start the conversation. You say, you don't seem your usual self today. Would you like to talk about anything? Right? Or you can say, oh, you look sad or worried today. Do you want to have a chat about it? Or is there anything I can do to help? Right? And we want to try to communicate concern. Like you can say, well, I may not understand exactly how you feel, but I care about you and I want to help. Right? We also want to try to remove means of self-harm, right? So if they've been cutting, you might want to remove things that they can use to cut, like blades, for example. You want to try to mobilize your family and friends and other concerned individuals to monitor and support, right? You want to be sensitive. And make sure that if they are suicidal, that they're with someone at all times. And someone can provide emotional support. Most importantly, I think when you have this awareness is that we try to encourage them to ask help, right? Why is it important? Well, one, because if we don't seek help, sometimes they will have more difficulties in functioning. In fact, like for example, depression can be treated, and other disorders can be managed. So if we prolong the time that they are able to seek help, then we're also increasing the severity of symptoms. Of course, the suicide and self-harm risk is there, right? We also want to try to rule out other medical conditions. So for example, there are certain medical disorders that may have low mood or anxiety as kind of like a symptom. For example, thyroid conditions can have that. And it's important to seek help so that they will be able to improve coping skills. How to deal with this. Now, how do we prevent it as parents? We want to try to enhance what we call resilience. Meaning, when we talk about resilience, it does not mean that the person doesn't experience difficulty, but it's something that can be learned and developed, right? So when you look at Google, it is basically defined as the capacity to recover quickly from difficulties or toughness, right? But if you look at the what we call more clinical definition of resilience, is the process of adapting well in the face of adversity, right? Or a significant source of stress, right? And it means bouncing back from difficult experiences. And as parents, I think we can all agree that this is what we want our children to have, right? We want them to be resilient. So a resilient individual have a realistic, positive sense of self. They regard themselves as survivors, feels that they can have an impact on their environment or situations rather than passive observers, are hopeful about the future, are confident in their ability to surmount obstacles and make use of resources and opportunities. And they view hardships as learning experience. So how do we build this at home? One is that we want to create family routines. No, routines are important because it gives us consistencies and structures, right? It also gives us time to be there for each other. No, be clear with rules and expectations. Now, some adolescents will really try to push their boundaries. No, they will really try to kind of even if you give them rules, they will try their best to kind of break them. No, so you have to be clear with what you're expecting with them. No, and what are the consequences of their actions, and you have to be consistent with it. Build a close relationship with them. You know, try to bond with your kids and look at what they're into, right? And see if it's something that you can also try to figure out, you know, so you can have a conversation with them. Be comfortable talking about emotions. You know, meaning you can also talk to them about how you're feeling because it allows them to understand that it's okay to talk about it. Like, for example, during this pandemic, if you're feeling a little bit anxious, you can just tell them, you know, I think it's kind of making me feel anxious. How about you, right? How do you feel, right? And then you guys can talk about it and you can get through it together, right? Model appropriate behaviors. No? So if we're expecting your children, for example, to not want to smoke, then you don't want to smoke also, right? Or if you want them to be more resilient, then you also want to be more resilient also, right? And communicate effectively. A lot of times, most of the family problems at home is due to miscommunication, right? We have to look at each child according to their own as a separate person. No? So like they have their own personalities, they have their own likes and dislikes. You know, they are coming from a different generation, and we all have to take this into consideration when we're communicating with them. Okay. I think that's my last slide. These are my references, right? Thank you very much for listening.
Thank you, Doc. I am sure that all the information that you have provided has given an insight to the audience. Now, to introduce our first parent reactor for this seminar, I would like to call on Dr. Anel Humamil.
Thank you. Can you hear me, Gab?
Yes, I can hear you, Doc.
Okay. So our first reactor is first and foremost a parent. She is a mother to 3 adorable kids, a mother of a Generation Y, a Gen Z, and a Gen Alpha, according to her. If I may add, she also serves as a mother to FEU faculty members since she is the president of Far Eastern University Faculty Association. She's also a faculty member of the Department of Communication. And last but not the least, she described herself as a warrior. Please welcome Ma'am Karen Lee Viudes Penela.
Hello, good afternoon, everyone. Thank you for that very informative information about me. Yes, I do describe myself as a warrior mom because ever since I've become a parent, I have been working. My husband is working overseas. So for several years, I see myself both as a mother and a father. And indeed, no, I am a a mother of a Generation Y. He's now 24 years old. He's my eldest. I have my ex-bunso. I always call him my ex-bunso because he is Generation Z. He is currently 17 years old. And my humabol na bagong bunso, my Generation Alpha, who is 2 years and 8 months. So maraming pong salamat. Though I have to already tell my my thoughts about the talk. Okay, so thank you, ma'am. The information shared by Dr. Zairah can be very overwhelming, especially for a parent who works full time, travels a lot, no, with regard to coming from Bulacan to Moraita in FEU. So much of my time has been spent basically in my profession as a university educator, but then it should not be an excuse on my part, okay? So it is also should not be something of an excuse when I have an absentee husband, okay, all these times, no? But then again, what is very challenging for me is that I come from a field in communication who should best exemplify how to talk with their kids. I also represent a mother who should best understand the nuances of the digital age, the threats and benefits of social media. So when Dr. Zairah mentioned something about our children, our teenagers spending a lot of time online, I totally agree with the idea na you should also be in that particular ecosystem of the online environment to better understand them. A colleague asked me, kailangan na ba akong mag-sign up sa Twitter? Sabi ko, you should. Because in my experience of handling, for the past 2 years, I was able to handle uh, Generation Z. It dawned on me that while they have Facebook as a typical platform for social networking, one thing that I realized, which they revealed, no, my students revealed, was that uh, marami po kasi kaming kamag-anak sa Facebook. Lahat po ng pamilya namin, lahat may Facebook account. So meron po kaming mga accounts na hindi po nila alam. So it scared me a lot as a parent because I felt na I also need to ask my kids, no, particularly my Generation Z, my ex-bunso, no, who has been with me for so long. Lahat ng decisions niya, honestly, I leave that to him. But then natutuwa ako because I don't know. I was raised by a grandmother, no, so I also had an absentee mom and an absentee father. But again, no, it should not have been my excuse to be able to fully fulfill, no, my duties as a mother, as a parent. So isa sa nakita kong realization is that as a parent, we should be not only digitally literate, okay, in terms of understanding social media, but with what Dr. Zairah shared, we should also be mental health literate. I think what a parent usually would do is to go online, initially seek answers through Google and probably through YouTube, right? And I totally have to admit na ginagawa ko din yon. And minsan nga napapagalitan ako na aking pinsan. She told me, ate, huwag kang laging pumupunta sa Google, okay, to understand things that I require answers. So parang mas lalong bumigat yung role natin as parents, and upon hearing the so many challenges that a parent must fulfill in this time of pandemic, the more that it becomes a partnership. Parang siguro I can consider myself lucky because I never imposed any strict rules with my children. I allow them to decide. And then sila naman yung nag-open up with the things that they want to share. I have understood, no, this very simple act online. I never comment too much in their posts. I would always use a private message and then tell him, oh, ano, kumusta na? Oh, para nakita ko yung picture. And then and I also realized that they don't want to be tagged in our posts, in our photos, especially if the photos that we share seem or appear to be unflattering. So, minsan nire-request nila ako, ma, wag alisin mo ako sa pagkakatag mo. So, from that time on, never na ako nagtatag. Unfortunately, the algorithm of social media, through its facial recognition, inevitably tags my kids, no? But yun yung isa sa mga na-realize ko with this talk, that it should be a partnership. We cannot be experts in the field of mental health. So we need to admit it to ourselves na we need to seek the help of professional people. In this time and age of social media, when our kids are spending a lot of time online, inevitably tayo rin namang mga magulang, we are also spending a lot of time online. So when Dr. Zairah shared about setting things at home like family routine, managing rules, I would like to siguro stress yung we co-manage and co-create rules so that their own rules that they would like to set, there is that sense of accountability too. O ikaw ang humiling nitong rule na to, so panindigan mo. So at least hindi ko naman pwedeng sabing meron akong masisisi, but at least they know the responsibility involved. And I also take note of showing our vulnerability to as parents, like revealing our emotions. Malaki palang bagay that we don't project that misleading facade that everything is okay, no, because they may see us as role models na okay, parang hindi affected si mama na sa pandemyang ito, so dapat pala hindi rin ako magpahalata na ako ay nai-stress sa online class. So yun yung mga nakita kong benefit of what Dr. Zairah shared, which siguro for my advantage as a teacher in communication, I can fully embrace. I just hope that the infrastructure here in the Philippines, particularly in the education sector, kailangan ma-introduce na, I think, sa curriculum, sa basic education, yung mental health is not just about sex education, but properly introducing these concepts to them. And syempre, media information literacy is something that our department advocates. And sana meron ding clamor sa buong society as regards the importance of media information literacy in the basic education before they reach senior high school. So maraming pong salamat for giving us, at least for me as a parent, for giving me the opportunity to also reconcile the expertise of Dr. Zairah. And I don't want to say my expertise as a parent, but at least my experience as a mother and as a father. So maraming salamat.
No.
Thank you, Gab. Can you hear me?
Yes, we can hear you, Doc.
Our second reactor is also a parent, a proud mother to an only son who is already an engineer. Apart from being a mother, she is a licensed guidance counselor, a licensed psychologist, a board member of Psychological Association of the Philippines, and a faculty member of FEU Department of Psychology. She was trained in cognitive behavioral therapy for personality disorders at Beck Institute in Philadelphia, USA, and a proud volunteer psychologist of FEU Psychology Clinic. Please welcome Dr. Clarissa De Lariarte, or we simply call her Doc Cly.
Good afternoon. Can you hear me?
Yes, we can hear you, Doc Cly.
Okay, good afternoon, everyone, and to our parent audience, and of course, to our guest speaker, Dr. Zairah. Thank you, Dr. Humamil, for that introduction. So this afternoon has been very fruitful, so I'd like to just make 3 points, no, as my reaction to the talk of Dr. Zairah. But before that, I'd like to emphasize that there is a very close ally or relationship between psychiatry and psychology. No? And it has always been a multidisciplinary approach, no, in terms of dealing with the mental health. So I am very glad that I am given this opportunity as psychologist to be able to give my reaction to the inputs of Dr. Zairah as a psychiatrist. Okay. So the first point that I'd like to put forth as my reaction is that awareness, no? Awareness is key. So this afternoon we have been made aware, perhaps for some of us, it has been a review, no? For some parents, they may be aware already of some of the things, but being aware and being updated with the information that we need for us to be able to deal with mental health is a very important aspect, no? Especially nowadays. So our very good speaker gave us a lot of hard statistics. No? It was actually research-based, and that's highly appreciated. No? With the increase of technology-related mental health issues like FB depression, we also have what we call the Phobia, internet addiction, and a lot of these internet-based or technology-based mental health issues. So that's the first thing that we will have to take note of, no, as parents and as practitioners, no, for us to be able to have that kind of awareness and updated in our information about mental health. So we should know when and where, no, to seek help. I think that has been emphasized by Dr. Zairah. It's very important that we teach our adolescents to know how to seek help. No? That is why in the FEU Graduate School Clinic, no, we have a very close tie-up with the Guidance Center. When cases become clinical in nature, no, they would want that the FEU Graduate School Clinic will deal, no, with these clinical cases. The second point is more and more, no, like food, like shelter, mental health now is a basic necessity. No? So if it's a basic necessity, we should be able to invest, no, in our mental health. So as parents, we have to invest in terms of time and presence, in terms of increasing our awareness, in terms of the concern and care that we give to our children. Okay, so that's the second point. And as emphasized by Dr. Zairah, mental health is associated with a lot of things that we have to do later on. So it's important that at this stage, we are able to manage our mental health, because that will determine how we will perform later on in the world of work when we get married. Okay, so it's a very important aspect. Can you hear me?
Yes, we can hear you, Doc.
Okay, so that's the second point. No, mental health now is a basic necessity. We need to invest, no, in our mental health. So investment can be in the form of a lot of things. Okay, and the third one, and this has been emphasized also by Dr. Zairah, is that of course we do not wait for the symptoms to appear. No, we would want to take the preventive measure, and as emphasized also by Ms. Karen earlier, no, it's getting more challenging to be a parent nowadays. No, it's really very challenging to be a parent nowadays, and therefore, from a clinical perspective, okay, mental health issues do not really come in a vacuum. Invest, no, in our mental health. Getting more, no, there are a lot of factors that would give risks, no, in developing mental health issues. And in my practice as a psychologist, it has always been the case that they will mention, no, family situations, family dynamics as one of the issues, among other factors. So that's how important the family is in terms of communication, no, in terms of discipline measures, the rules, no, that we have at home are expressions of care and concern, the way we make decisions, no, these are all very important. So being mindful of how these things would influence, no, the mental health of our adolescents will be a big help, okay? And yeah, we have to be role models, no? Of course, we admit our vulnerability, and that will also assure our children that we are also affected. But more than that, we have to be role models of people who are able to manage and rise above challenges, because they never end. No, this pandemic, of course, has served as a risk factor, but this is, I hope, I hope this is a temporary thing for all of us. No, but apart from this, every day is always a day full of challenges. No? So as FEU says, let's be braver today and every day. We need that, no? For us to be able to manage the things that come our way. As they say, do not worry that your children do not listen to you. Worry that they're watching you. No, I think that's a very important mantra that we can give to ourselves as parents, no? We might be giving a lot of signals in terms of how we are able to rise above these challenges and how we are able to adjust without breaking. So let our words encourage, our actions give support, and our presence bring security to our children. Because after all, they are the future of our life. So thank you very much for this opportunity to the organizers. Maraming salamat po.
Thank you so much, Doc Clay. We will now move on to some questions that parents may have from the seminar, which will be care of Ma'am Edalu Ochanko. We cannot. Ma'am, we cannot hear you.
Can you hear me?
Yes, we can hear you now.
Doc and Ms. Gab. Okay, Doc, good afternoon. This is our first question from Facebook, from Danica Sila. Here's her question. Knowing po na there are some people who are not privileged to access mental health support po, ano po yung pwedeng mai-advise sa kanila?
Okay. Actually, there are certain, we have other institutions that can give mental health support that doesn't have to be for those people who cannot afford it, no? Meaning government hospitals, let's say PGH, National Center for Mental Health, they all have, for example, psychiatric services, no? That is available for mental health support, no? In our school, the guidance office, they're also a good, I think they are a good resource also, no? So if a student is having some difficulties, then you can also tie up with the guidance office, and maybe they can also connect you with someone, no, that can help you out. No? Madami naman po na pwede. No?
Okay, Doc. Thank you for your advice. For our second question, Doc, how do I know if my child is just sad or is already suffering from a mental illness?
Okay. So this is what we were talking about dun sa graph that I showed earlier, wherein sadness is actually not necessarily a bad emotion. No? It's actually a normal emotion. No? But when it reaches that point where it becomes persistent, meaning it's there from 2 weeks or more, and it's starting to affect the functioning of the child, meaning hindi siya kumakain masyado, he's not sleeping so well, or that it's affecting his studies or social skills, no, then we might be considering a mental health problem, no. For example, it might be a clinical depression instead of just normal sadness, no.
Okay, Doc. Thank you, Doc. For our third question po, how can I tell if my child's mental health concerns are getting serious and requires immediate medical attention?
Okay. Well, if usually when it reaches the immediate would be when they have problems with um, emotion regulation, wherein they would want to harm themselves. No, so when they're starting to cut, no, when they are thinking about suicidal thoughts, then that is of course an emergency. No, that one you really need to see a professional. But I think personally, when you see that their functioning is declining, mapapansin niyo po yun eh. Parang most of the parents who goes to me, they say parang hindi na siya yun. That's not his usual behavior, no? When you see that there's a decline in functioning, then I suggest you really seek help. Huwag niyo na pong paabutin dun sa point wherein she would begin to hurt herself, no? Because our goal is to prevent that from happening, you know?
Follow-up question for that, Doc. In case my child or the child is resistant, are there any safety plans that parents can do at home while convincing their child to seek medical or psychological attention?
I think it's important to really talk to them because a lot of kids are um, having hesitancy because they feel that sometimes when you ask help, it's a sign of weakness, when in fact it's not. You know, it's something, sometimes, for example, with clinical depression, you have to emphasize that it can be treated. You don't have to suffer through it. No, it's a condition that can be managed, and that's one that's important. Second is that you have to make sure that the child's safety is the pinaka-important at that time. If they're showing signs of having suicidal behavior or self-harm behaviors, then you really have to make sure that there's someone with the child, you know, looking after them. You know, make sure that all the things that they can use to harm themselves, you can parang tataguin natin. Even the mga vitamins in the house or the biogesic that we usually have lying around the house, if they start to have suicidal thoughts, you might want to keep it inside the medicine cabinet. No, because these are the things. No, adolescents, as we said earlier, can be impulsive. No, so sometimes at the height of emotions, they might do something impulsive. You know.
Okay, Doc. Still related to that concern, Doc, in case the child is resistant, how can a parent bring up the topic of mental health once the parent sees the signs and symptoms you mentioned earlier?
Yes. So, like we said earlier, you have to kind of communicate it. Like you just notice, oh, I see na you're parang medyo malungkot ka lately. Meron ka bang problema? No, so begin with just kind of talking to them, or how have you been feeling? Or parang you look stressed lately. Is there anything else that's going on? How are you feeling? And from then, snowball lang. Kaya it's really important to develop a very parang close bond with your children, so they will be comfortable opening up to you.
So it's really communication, Doc.
Communication. Sometimes it's also, just to make, so I can add lang, sometimes it's also being open to the help yourselves. Kasi sometimes if you say, oh, maliit na problema lang yan, you know, that also makes them feel like they don't want to help. They don't want to ask help, right? So you also want to be open to the help themselves.
Okay. Okay, Doc. And then, Doc, maybe for the last question, on the brighter side naman, Doc, how can a parent tell if the child is already making progress from, let's say, medical, psychiatric, or psychological attention that he or she has been receiving?
Mm-hmm. Well, you can see it through the symptoms are starting to decrease. So usually, for example, if they are depressed, the tendency they will start to talk to their family more instead of nagkukulong sa kwarto, right? Their grades, or they're able to focus more in school, right? They are able to talk more, to share their feelings more. In terms of appetite, mas kumakain na. Sleep is also a good indication. No, if you see that their sleep is getting normalized, then it might be an indication that they might be getting better.
Okay. Doc, pahabol pang 2 questions. So, how about some advice for parents who claim na arte lang yan? So, how to handle parents who think that way?
Okay. I think this is important. It's always good to do psychoeducation, meaning to educate the parents about mental health issues. Because even if it's arte lang, no, even if it's something that they are seeking attention, it is still a behavior that needs to be addressed, no? Because you have to ask yourself, what is the cause of them seeking attention from you, right? And so I think that's very important, no? And this is what I was saying about the not being non-judgmental. So sometimes there are some people who would say, oh, arte mo lang yan, inarte ka na naman, right? And for the child, they might feel invalidated, no? And they will close up. They will not talk to you anymore, right? About their problems. No? So when someone shares it to you, you have to look at it from the perspective of the child. Whatever they're feeling, whatever concerns that they're having, it's valid for them because they're the child. Sila yung nakaka-experience nun. No? So, yun po yung kailangan nating tandaan.
Thank you, Doc. Do we still have time, Ms. Gab? There are 2 more questions online. So one from Karen. Paano mababawasan ang social stigma ng nasa lahi ang pagiging baliw or may history sa pamilya in addressing the issue of mental health?
Well, there is a genetic component of psychiatric conditions, no? That is kind of something, but you always have to look at it. Mental disorders or psychiatric conditions are similar to physical conditions such as hypertension and diabetes. You know, di ba we look at the diagram that I said, the biopsychosocial model. It's not because, like, if you have diabetes and you have a genetic predisposition, at risk ka na magkaroon ka ng diabetes. Pero it doesn't mean you will have it 100%, right? Kung kakain ka ng matataba, matatamis, di ka nagda-diet, di ka nag-exercise, there's a lot more chance that you will get it. Similar to psychiatric conditions, right? There is a genetic component of some psychiatric disorders, but there are also psychological and social factors that are affecting it. If you're in a loving environment, right? When you feel nurtured and cared for, it doesn't mean that you will have it, no? So yun po yung ano natin.
Okay, Doc. Thank you so much, Doc. And last question, Doc, from Facebook again. What could be the possible alternative ways that can be accessible and affordable to people to help them with their mental health?
Well, of course, the preventive aspects of it will always be going on a healthy diet, right? Meaning rich in omega-3 fatty acids like salmons and tunas, no? Doing regular exercise can be a good thing, no? Doing some meditation and mindfulness can be one. No? So there are a lot of meditation apps available, right? That you can try to do, no, to lessen your stress, no? As family, it's spending time with your family, you know, taking time to listen to them, to expressing how you care for them and how you love them. That's something that that's also very important.
Thank you so much, Doc. Thank you.
Thank you so much, Ma'am Eda, for providing the questions and delivering the questions, and especially to Doc Zairah Corpus for the helpful answers. Now, before we bring this webinar to a close, I would now like to call on Sir Mark Isla, Associate Dean of the Institute of Arts and Sciences, for the closing remarks.
Hi, good afternoon. Can you hear me?
Yes, we can hear you, sir.
Yes. So to our guest speaker, Dr. Zairah Castelo-Corpus, Dean of our Institute, Dr. Rowena Capulong-Reyes, Dr. Anel Humamil, Program Head of the Department of Psychology, faculty members, students, and parents, good afternoon. First, I'd like to thank everyone for joining this part of the series of webinar organized by the Department of Psychology, intended for parents who are raising and caring for their children who are considered to be part of Gen Z. As emphasized by our dean in her remarks, this is our small way of helping our parents and students to have a better understanding of mental health, especially now that the COVID-19 pandemic creates a situation that further amplifies mental health concerns. I believe that our distinguished speaker shared many insights on mental health. What are the telling signs or symptoms that adolescents are exhibiting when they experience mental health issues? These are crucial information for every one of us so that we can be more sensitive or empathic to their needs and be able to create an environment that can help them cope with the situation. My takeaways for this webinar are the idea that one, we sometimes overlook the signs and symptoms of mental health concerns. Two, we can prevent serious consequences of having mental health issues by constantly communicating with our family members and establish routines for every member of the family. And three, there's nothing wrong about expressing your emotions because it can make you more resilient as you face more challenges and adversities. This afternoon, I also enjoyed the discussions given by our reactors who shared their insights as professionals and as parents. Of course, I think you don't need to be a parent in order to understand the situation that people with mental health concerns go through. You can be the brother, the sister, uncle or aunt, or a friend who can be of help to those who are experiencing this situation. So with this, I'd like to sincerely thank our guest speaker, Dr. Zairah Castelo-Corpus, for sharing her time with us. And I hope that you were able to get good insights about this webinar and hope to see you again for our next webinar organized by the Department of Psychology. Thank you and have a good day.
Thank you so much.
Thank you, Sir Mark, for the words. Now that the webinar has ended, we would like to thank you all so much for attending this webinar. I hope you all have learned some important things when it comes to detecting the signs and symptoms among adolescents and when to seek professional help for these cases. Once again, thank you and good afternoon.
Thank you.